Welcome to Business Connection. I'm Liz Spencer. We have wonderful guests in studio today. It's Dr. Aslan Tariq, and he's the owner of Optimal Health Medical Fitness. And alongside him is Chris Cg. He's the medical specialist director with the group. So welcome, gentlemen.
Thank you for having us.
Tell me a little bit about your practice and what it's all about.
So first of all, I'm a board-certified physical medicine and rehabilitation doctor, specialized in sports medicine, pain management, and regenerative medicine. So my primary focus is non-surgical orthopedics. It basically means people who have injuries, they come and see me if they don't want to get the surgery.
Wow, okay. And tell me about the types of patients you like to treat.
So I get patients that are as young as 12 who are gymnasts to old as 30 who are running a marathon, or a 55-year-old female or male who has arthritis in their knees or hips. So, they typically come and see me as a second or third opinion, sometimes the first opinion, and they've gone through the whole healthcare system. They're frustrated with things, how things are. They've been offered the pain medicine and the surgeries, and they want the options.
Excellent. And when you say regenerative medicine, what is that?
So regenerative medicine is not a new concept. It's been around for about 25, 30 years now. It's basically, initially was exposed to all the pro-level athletes, like Tiger Woods and Kobe Bryant. They got access to it, but eventually it trickled down to the normal population. And the idea of regenerative medicine is your body has innate ability to heal itself. So you have stem cells and platelets that heal yourself. So what I do is I take those cells, your own cells, and put them back into where the injury is. So if you have a rotator cuff tear, your options when you go see a surgeon is, well, we have to go fix it and repair that. Of course, there are times in which you have to do that. But if you have a minor tear or something that can be fixed, we take those cells from you, put them back into your body. So there's no downtime. There's no complications, no pain, and no side effects usually, because it's your own body, so you're not putting a foreign object into it.
Wow, that's fascinating, fascinating. Now, Chris, tell me a little bit where medical fitness comes in there.
Yeah, so medical fitness is evidence-based fitness. So it's not your trends at the gym or your fad diets that don't work, that people keep repeating. Everything we do is backed by science. So from the fitness, the HIIT training, high-intensity interval training, which is proven to be the best for weight loss, to our low glycemic index nutrition, as well as working directly with the physician for those that need it.
Right, I was going to ask how the two of you work together, but at Optimal, it seems to be you kind of have a one-stop shop. So tell me a little bit about that.
Yeah, we're very fortunate about that. So when I was working in the hospitals, basically I noticed a big rift or gap between the fitness world and the health world. So obviously as physicians, we're managing disease and we're trying to prevent the complications that were happening. But when I was talking about fitness to my patients, I would say, go join a gym or see a trainer. I had no control over what happened afterwards. If I sent to therapy, I had control over that, but not this. So that's where I decided that let's kind of gel out together. If I have a client who comes in, a patient who has knee pain, but the reason they have knee pain is because they're 400 pounds, if I can help them lose the weight, they might not need the surgery or the pain medicine. So hence we have our chiropractor, our functional medicine doctor who focuses on hormone balancing and nutrition, and we have our trainers who, under my guidance, they help these clients get the optimal results. So if they lose the weight and in the meanwhile I'm helping them with their pain, help them heal, then they are able to do their exercises versus saying that, oh, I can't because I have pain.
That's wonderful. Now, Chris, somebody who just is thinking about wanting better health and doesn't know where to start, they can come see you before they get injured, correct?
Absolutely. So they'd contact us through website or phone, and we could either schedule for a physician if we feel that they absolutely need that first, or if we think they can start with the fitness. We start them off with a free health consultation. We go through biometric readings, goals, and then their starting point, their baseline, and then we map it out from there. Every appointment or every session is appointment based, so it keeps them accountable. And then from there, we offer a money back guarantee because we guarantee our success with them, and that's how the program goes.
So, Doctor, you mentioned that you're often the second or third opinion, but what if we are more wanting just a first opinion, that we know we already have some pain or discomfort, we have an injury, and we already know in our minds we really don't want a surgical option for this?
Unfortunately, not a lot of people like that. Usually when you go see your primary care doctor and they're training, they're going to send you to an orthopedic surgeon who basically, because they're a surgeon, they're focusing on that part of their training. So unless you're informed, you might not get that first option. Thankfully, we have people, that Chris is educating. In the meanwhile, they come and see me, and it's much easier. But my goal when I see a patient, I spend an hour with the patient, and that's unheard of.
Right.
For a new patient, I go over their MRIs, I educate them about their condition, and I'm, as an osteopath, which is similar to an MD, but we have extra training, I expose them or tell them about options about acupuncture, chiropractic care, supplements, surgery as well, and pain medicine. So I discuss all the options. So in the end of the day, they're more educated than before. Most patients that come and see me are word of mouth, because they tell their uncle and aunt and their son that come and see me. And if I can help them live a more fulfilling life and be more independent and have less pain, I feel fulfilled.
Well, I think that's wonderful that you give us the whole picture, because I think oftentimes that we only see a little bit of what is possible when we're injured or you're needing advanced care. So thank you for stopping by. Thank you for what you do. You're really doing a lot of great work. You guys are going to be changing the face of medicine, and we're going to be right back with more Business Connections. Stay tuned.